So let me ask you, because you described, so I want to make it clear to the audience and correct me if I'm wrong, but you're really the first individual pioneer that has done ablation for intratumoral therapy.
Yeah.
And so I recall in your chapter, you talked about a patient that had 4 lesions in his lung, 2 in each side, but you felt it would be too overwhelming for the patient to undergo ablation of all 4 lesions. And I can't remember if that was cryo or
That was
radiofrequency
radio
ablation.
frequency at that
Okay.
time. Yeah,
Okay.
though we were doing some cryo. We saw it in both situations occasionally.
So with that patient, you treated him and then you came back several weeks later. And the other side that you didn't treat, those lesions were gone.
Exactly.
Was that like one of the light bulbs that was going off?
Definitely. Obviously at that time, thoughts were not really like you're going to stick needles and inject drugs, or you're going to do things, you're going to, stick a needle and you're going to ablate it. You're going to destroy a tumor. So there's tumors and we're like, oh, we can just pick them off. So that's what we were looking at. But what we were seeing was that, in certain circumstances, when we killed the tumor, we generated an immune response against the cancer. And then not only the cancer that we treated responded, but occasionally the other lesions that were not touched responded.